a special FFP3 face mask. That is Lars Fischer's most important protection. The 43-year-old was born with an illness called Fraser syndrome and had a kidney transplant. COVID-19 poses an acute danger to his life. Every time he leaves the house, he takes a risk.
I always have to be lucky. The virus only has to be lucky once.
If I then think about the hospitals which are filling up, the fact that I can't be properly cared for, can't be visited, what if I get seriously ill? These are thoughts that go through my head. The coronavirus vaccinations are not having their full effect on him. Since his transplant, Lars Fischer has been taking immunosuppressive medication every day to prevent his body from rejecting the organ. After the first two vaccinations, I had very few antibodies, and only the ones that don't protect you. Now I've had 4 doses, and I'm still waiting for the results, but I'm afraid it still doesn't look very good. Lars Fischer knows that compared to many other people with disabilities, he has made it through the pandemic relatively well so far. This is also due to his profession. He is a science journalist with a focus on infectious diseases. He has been able to put his specialist knowledge about infectious diseases to good use over the last 2 years. It was also an incredibly exciting time for me professionally, because I was one of the very few journalists in Germany who really knew something about pandemics, and that was something that gave me strength, that ultimately also carried me along. Lars Fischer expects to get infected with COVID-19 at some point, but he hopes that by then, a drug will be available to treat him well.
Here's a look at some other developments in the coronavirus pandemic. The World Health Organization is calling on wealthy countries to fill a $23 billion funding gap to help poorer countries fight the coronavirus. The WHO says unequal access to tests, treatments, vaccines, and protective equipment risks prolonging the pandemic. Hong Kong says it's recorded its first possible COVID-linked death in 5 months. Despite a zero COVID policy, the city has reported hundreds of new infections in recent days. And the U.S. state of New York will drop its indoor mask mandate for most public places starting Wednesday, the New York Times reports. The state's governor intends to let the mandate expire rather than renew it, the paper said.